Wobbler syndrome in dogs. What is it and how can it affect your canine companion? Dogs are part of our family, and when they face health problems, it worries us deeply. One of the lesser known but serious neurological disorders that can affect dogs is wobbler syndrome or wobbler in dogs. In this post we talk in depth about this syndrome, from its causes to its symptoms and treatment options. What is wobbler syndrome in dogs? Wobbler syndrome, also known as cervical spine disease or cervical spondylotic myelopathy, is a neurological condition that primarily affects large or giant breed dogs. It is characterized by abnormal compression or narrowing of the spinal cord in the neck region, which can cause a number of worrying symptoms. Causes of wobbler syndrome. Although not all causes of wobbler syndrome in dogs are fully understood, it is believed that a genetic predisposition exists in certain breeds, such as the Great Dane, Doberman, Rottweiler, Basset Hound and Dogue de Bordeaux. Additionally, nutritional and environmental factors may also play a role in the development of this condition. Symptoms of wobbler syndrome. Symptoms of wobbler syndrome can vary in severity and may include 1. Ataxia. Ataxia in dogs refers to a lack of muscle coordination, which causes the dog to have difficulty walking and maintaining balance. Dogs with wobbler often show an unsteady, wobbly gait pattern. 2. Stiffness in the neck. Dogs with this condition may experience neck stiffness and difficulty lowering their head or moving it laterally. 3. Difficulty getting up. You may notice that your dog has difficulty getting up from lying down, and may show weakness in his hind legs. 4. Frequent trips and falls. Due to lack of coordination, dogs affected by wobbler syndrome will often stumble or fall more frequently than normal. 5. Pain. Some dogs may experience neck or back pain due to spinal cord compression. Diagnosis and treatment. If you suspect your dog might have wobbler syndrome, it is crucial to seek veterinary care immediately. Diagnosis usually requires a combination of physical exams, X-rays, MRIs, and blood tests. Treatment for wobbler syndrome will depend on the severity of the condition and may include 1. Medical treatment. Medical treatment may include corticosteroid therapy to reduce inflammation and pain, as well as physical therapy and controlled exercise. 2. Surgery. In severe cases, surgery may be necessary to relieve spinal cord compression. This involves stabilization of the affected vertebrae to prevent further compression. Three. Nutrition management. In some cases, it is believed that diet and nutritional management may influence the progression of wobbler syndrome. Consult your veterinarian about appropriate dietary options. 4. Physical therapy. Physical and occupational therapy may be helpful in improving muscle strength and coordination in dogs with this condition. Prevention and long-term care. If you have a breed predisposed to wobbler syndrome or notice early signs of the disease, prevention and long-term care are essential. Make sure you provide a proper diet and avoid being overweight, as excess weight can aggravate the condition. Additionally, it provides a safe and hazard-free environment to prevent injuries. How long can a dog with senile dementia live? Most common diseases in boxer dogs, congenital diseases in dogs, understanding and addressing a canine health challenge, rheumatoid arthritis in dogs, understanding and addressing this debilitating disease, acute idiopathic polyradiculoneuritis in dogs, a clinical challenge. Conclusion: wobbler syndrome in dogs is a serious neurological condition that requires immediate veterinary attention. Recognizing the symptoms and seeking early diagnosis and treatment are essential to improving your dog's quality of life. As a responsible owner, your role is to provide the care and support necessary to help your canine companion live a full, healthy life. Brain injury in dogs, symptoms, causes and treatment. Dogs are known for their loyalty, intelligence and unconditional love towards their owners. However, like any living being, dogs can also face health problems, including brain injuries. Brain injuries in dogs can be devastating for both the animal and its owner. In this post we talk in depth about brain injuries in dogs, from their causes and symptoms to the treatment options available. Causes of brain injuries in dogs. Brain injuries in dogs can be caused by a variety of factors. Some of the most common causes include head trauma, car accidents, falls from heights, blows to the head, and fights with other animals can cause head trauma in dogs. These traumas can seriously damage the brain and its structures. Infectious diseases. Some infections, such as rabies, encephalitis, and leptospirosis, can affect the central nervous system of dogs, resulting in brain injuries. Brain tumors. Tumors in the brain are a major cause of brain injuries in dogs. They can be benign or malignant and cause a variety of symptoms. Epilepsy. Epilepsy is a neurological disease that can cause seizures and brain damage in severe and uncontrolled cases. Poisoning. Exposure to toxic substances such as rat poisons, household chemicals, or certain foods can cause brain injuries in dogs. 1. Changes in behavior. This may include aggression, disorientation, depression or lethargy. 2. Seizures. Dogs with brain injuries often experience seizures, which can vary in intensity. 3. Loss of coordination. Difficulties walking or maintaining balance.